Hello, and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, doctor of nursing practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. We are a full service primary care health and wellness practice, servicing all of your healthcare needs from infants to elderly, from minor cold to minor injuries to some weight loss to hormonal changes, you name it, we do it. Physical exams, DOT physicals, we got you. So if you are in need of any services, if you need to consult with someone regarding lab work that you're not sure what it means, if you're in need of a new primary care provider, if you have something going on and you're not sure what's happening, reach out to us. Or if you have questions and you just need some answers, we're here to help you and partner with you on your healthcare journey. Wellness Wednesday. Many people may not know what Wellness Wednesday is all about. I would assume that the name would just speak for itself. However, Wellness Wednesday is an opportunity for myself and several other amazing colleagues and friends and healthcare workers and providers that I have connection with or that I've met in passing who will partner with me to bring you all important health information related to your healthcare, your wellness, the whole person. So there are some weeks we may talk about self-care. There's some weeks we may talk about colon cancer, which is what we're going to talk about tonight. Each month, I try and bring you a different health topic that's highlighted in that month so that you are aware and you're abreast of what's going on. Any updates or any changes that are happening within guidelines, you'll hear it right here. So sit back and enjoy. Make sure you like and share this information with someone. You can catch us each and every Wednesday. Well, not each and every Wednesday, but majority of the Wednesdays throughout the year, we are live for Wellness Wednesdays. There are some Wellness Wednesdays where we will take off just to give ourselves a break and to relax and rejuvenate, or we may have competing priorities at the moment. But anyhow, we will provide you with the information that you need. We can be found on all social media platforms, Facebook, Instagram, YouTube, you name it. If you had not have an opportunity, please go and subscribe to our channel. It's Wells Legacy Health and Wellness on YouTube. Share this information, like and share tonight's live, and share it with someone. Maybe it will help somebody. Maybe it'll get them encouraged to go and get screened for colon cancer. My goal is just to make sure that my family, my friends, and my community have what they need to be able to create a legacy of good health. And that starts with your health and wellness, and it starts with you. So hopefully something that I talk about tonight will encourage you to get screened or encourage someone that you know to get screened. Tonight, we're going to talk about colon cancer in the younger adult. Many times when I talk with individuals, they say, oh, colon cancer is an old person disease, something that old people get. That's not necessarily the case. If you listened to last week's live, then you'll know that I talked about a student of mine, or I believe it was last week. It may have been the week before. But I talked about a student of mine when I was full-time faculty at a local community college here, teaching in the RN program. And I had a student who was, I believe she was 20, she had been less than 25 years old, less than 26 years old. And she had colon cancer, and it was a very aggressive form of colon cancer. And so it's so important that we talk about this, and that those who are under 45, even those who are under 25, pay attention to this information and know the signs and symptoms and know the warning signs. So we're going to talk about that tonight. Colon cancer in those under 45 are rising. The number of cases of individuals under the age of 45 is increasing year over year. It's the second leading cause of death of cancer-related deaths in the United States. Second leading cause of cancer-related deaths in the United States. Many young adults ignore the symptoms, which leads to late diagnosis and can be terminal or detrimental by the time it's found out, which I believe was the case for this student of mine. There's also a young lady who is a Howard University student who is battling colon cancer at the moment. And this young lady had some things happen to her health-wise. And on top of that, now she's dealing with colon cancer. And so Our thoughts and our prayers go out to her. I will see if I can find her information and share. There is a GoFundMe account for her and for her family. And if you're led or you feel that you would love to help, please do so. Her name is Janaya. Beautiful young lady, unfortunate situation that she's in, but we're definitely praying for her. Have you or someone you know been affected by colon cancer? If you have, I'm encouraging you to drop a blue heart in the comment. I can say that I have been impacted by colon cancer. I have family members who have been diagnosed with colon cancer. I know of individuals who have died from colon cancer, and these are young individuals who have died from colon cancer. I have friends whose husbands and whose wives have had colon cancer and who have gone through the treatment. I know individuals in my Peloton community that have gone through colon cancer treatment and are currently dealing with and battling colon cancer. So I can put quite a few hearts, blue hearts in the comments. But I'm encouraging you tonight, if you or someone you know have been affected by colon cancer, drop a heart in the comment for them. I want to make sure that if you have any questions, you can type questions in the chat. I may not be able to see them while I'm on live because I have one view. However, I will go back and review those questions and provide answers to the questions. So as you guys know, I love to provide you with some statistics. Some statistics on colon cancer is cases in people under the age of 50 have risen by nearly 50% since the 1990s. By the year 2030, colon cancer in young adults is expected to double. Many diagnosed under the age of 45 have no family history. Why is that? The foods we're eating, the alcohol consumption, not really paying attention to your body and what's going on. But it's amazing that there's no family history. And in these two young ladies that I spoke about, there was no family history of colon cancer. I'll share my story about colon cancer scare and reasoning that I had to get my first colonoscopy when I believe I was 26. I'll share that. I recently got a phone call from a really good friend of mine asking about what the prep looks like. What I just signed up for my colonoscopy. What does that look like? I just scheduled it. What am I in for? So we're going to talk about that. And kudos to you, friend, if you're watching, for scheduling your colonoscopy. Some shocking realities that we need to know. Many healthcare providers dismiss symptoms of colon cancer in younger adults. My hope is that that's changing. As we know what research shows and what we know what the numbers are showing and what data is showing and what cases are showing, individuals under the age of 45, younger population, they don't have a family history and they're diagnosed at a later stage of the disease process. Late stage diagnosis is more common in young adults, again, because those individuals dismiss the symptoms, they don't pay attention to it, and then they're dismissing the symptoms, and then they go in for treatment, and the symptoms are misconstrued with some other type of condition or disease. Diet, we talked about that. Some lifestyle risks. What are some of the things that put this group of people at higher risk for developing colon cancer at such a young age? Diet. So diet that's high in red and processed meats and low in fiber. When we look at how many of us know a young adult? Look at what they're eating. We have some who are very health conscious and they watch what they eat and they eat very well. They eat the rainbow of foods. However, we have a majority of those individuals that fit within that category. They eat diets that are high in red meats and processed meats and low fiber. They have a sedentary lifestyle. They lack exercise, increase the risk. We have more people that are working from home, that are sitting majority of the day, who are not getting out and exercising as they should. I'm not going to get on my soapbox about exercise. You already know 30 minutes a day of moderate intensity exercise. And then obesity. So higher body fat is linked to an increased risk of cancer, including colon cancer, as well as others. And then also alcohol and smoking, which includes vaping. both raises the risk significantly for this population. We're seeing more and more vaping, we're seeing hookah, we're seeing smoking, cigarettes, tobacco, marijuana, you name it, as well as alcohol. Increases the risk for developing cancer, including colon cancer. If there's a family history, right? But remember, in the younger population, many of the cases, there is no genetic link. There's no genetic link. No one in their family that they know of has had a diagnosis of colon cancer. So in this population, we see higher cases and higher incidences of inflammatory bowel disease, or IBD, such as Crohn's disease or ulcerative colitis, which puts them at a higher risk, as well as having diabetes type 2 increases the risk for colon cancer as well. So what are some of the signs and symptoms, some of the warning symptoms that we need to know? One of the things I want to stop and just say, listen to your gut. Your body will tell you when something is not right. And it's important to pay attention to that. So don't ignore these symptoms. Blood in your stool, bright red or dark red blood. A normal, healthy individual should not have blood in their stool in no shape or form, color, what have you. Constant changes in bowel habits, diarrhea, constipation. One day you have regular stools, then all of a sudden you have diarrhea, and then you're dealing with constipation, then you see some blood in your stool. There's something going on and it needs to be figured out. Unexplained weight loss. I know there are many individuals who are on their weight loss journey, they're on their health journey, they're working out, they're taking care of themselves, and that's intentional weight loss. But when you're not doing anything to lose weight and you're losing weight, more than 10%, I believe it was more than 15% of your body weight over a short period of time, there's something going on. Ongoing stomach pain, cramps, bloating are some other symptoms. And then feeling like you can't fully empty your bowel. So you go to the restroom to have a bowel movement and you just feel like you never completely empty out. Something is going on. And then unexplained fatigue and weakness that's linked to anemia could be indicative or be a sign of internal bleeding, which is letting us know that something is going on. So if you feel something is off, go and get checked. Go and get checked. Even if it's just nothing, go and get checked. If something is happening, you're experiencing either one of the symptoms that I mentioned, or your body, something just does not feel right, go and get checked. So what are some of the things that we can do to reduce the risk, right? Apart from paying attention to the signs and symptoms to catch it early, lifestyle changes, lifestyle modifications, we talk about that a lot on Wellness Wednesdays and when I'm talking to my patients. So eating a fiber-rich diet, the fruits, the veggies, the whole grains, eating the color wheel of foods, right? So eating all of the colors. We talked about exercise, 150 minutes per week is important. Cutting back on alcohol, quitting smoking, quitting vaping. Had a conversation with a young man today, and we were talking about drug use and employment. I'll put it like that. And so the conversation went something like this. Well, there's other drugs that are worse than marijuana. Well, it's still a drug. And so whether it's marijuana, whether it's CBD oil, whether it's whatever they're putting in the vaping or smoking or drinking alcohol, cut back. Cutting back on these things are going to really help turn around your health when there's something going on or when you're going down the wrong path when it pertains to your health. And then maintaining a healthy weight is going to be important as well. So what are some of the new guidelines for screening and early detection? The newest guidelines recommend that we get screened at the age of 45 or earlier if you have any of the signs and symptoms that were mentioned, or you have a family history and you are a Black or brown individual. So what are some ways that we can get screened? One of the ways that you can get screened for colon cancer is an at-home stool kit, which is called the IFOBT kit, which you take a sample of your stool, put it on this little container or on this card and send it in or bring it back to your doctor's office or to the lab. What that test looks for is the presence of blood in your stool. There's something else called the FIT DNA test. This looks for cancer cells within the stool. It looks at the DNA of the stool and it searches for this specific DNA that's linked to cancer. And so, what are some of the ways that you can get screened apart from that? So, you'll generally be ordered a colonoscopy, right? And everyone at the age of 45 should have one, unless you have some of these symptoms or you have a family history and you are of Black and brown population. You will likely get screened earlier, depending upon. Those individuals tend to have later diagnoses, and it's a more aggressive type of form of cancer when it's found out. Colonoscopy. So what does that look like? You go to your doctor. It's time for you to get your colonoscopy. They're going to write you a script. You got to go see a gastroenterologist or a GI specialist, and they're going to walk you through the process or the prep. So you go see the GI doctor. They're going to order your colonoscopy. They're going to send you over a prescription for some medication or some prep for your colonoscopy. There are several different types of preps. There's the standard old school liquid where they're going to give you this jug of powder that you're going to mix water with, and it's almost like about a gallon. And they're going to tell you you're going to start drinking this at a certain point throughout the night, and all throughout the night, as well as into the next morning leading up to your procedure. There are some pills that you can take. There are some other methods of prepping yourself for a colonoscopy. Some providers will use the magnesium citrate, have you drink a couple of bottles of those, followed by some water or Gatorade, things of that nature. Some of the things I want to warn you against is making sure that you're not eating any heavy foods when you're doing this prep. The goal is to cleanse out your colon, to empty the colon completely out. You want the liquid to be clear or as near clear by the time you're almost finished with your prep. You don't want to go in for your colonoscopy and you have not completed the prep appropriately and they're not able to see because your colon is not cleaned out. And then you have to repeat this whole process all over again. So depending on your GI specialist, your provider, will determine what type of prep that you will have. So once you've drank the prep, you'll go into the facility. They're going to talk with you, go over the procedure with you again. They're going to get your blood pressure, your vital signs. They're going to start an IV. They're going to maybe give you some fluids depending on what their protocols are. And then they'll bring you back into the suite or the surgical room where you'll have your colonoscopy. The anesthesiologist is going to be there. They're going to talk with you and kind of give you some instruction. They're going to give you some medication. Typically, it's propofol. Put some oxygen on you, and off you go to sleep. The colonoscopy is over before you know it. You're going to wake up and you're like, wait, it's over? Because that's what I did. I woke up like, wait a minute. It's over? You guys are done? It's done. You're not going to remember it. If there's anything found, which most of the time there's some polyps that are found, there's some times where there's cancer that's found. Generally, if it's a clean, good, healthy colon, they won't see anything, no polyps or anything, and they'll let you know your colonoscopy was good. There was nothing found. We want you to follow up in 5 or 10 years, depending on their protocol. If there's a polyp or something that was found, they may order some testing on the samples that they took and additional treatment or surgeries, depending on what was found. So if you have a normal or negative colonoscopy, chances are you'll go back in between 5 and 10 years, depending on the guidelines that your provider is using. And so when you go home, make sure that you're staying hydrated beforehand as well. Make sure you're overhydrating or staying hydrated. Depending on your health history, if you have congestive heart failure, you got to be careful with drinking too much fluid. So follow the instructions of your provider. But I always recommend individuals to make sure that they're hydrated. When you come home after your colonoscopy, take your time building yourself back up to eating solid foods. You don't want to go right out and eat a burger. You don't want to go right out and eat anything too spicy, what have you. Take it slow. Give your system time to readjust and to acclimate after having this procedure done. The worst part of the colonoscopy, I tell people, is the prep. It's the worst part, but it's necessary. And you want to do it correct the first time to prevent having to repeat that step. So I want to make sure that you are, again, advocating for yourself. We advocate for our patients. We have gone into the hospitals. We've been on the phone calls and conferences with patients and their families to help advocate for them, to help make sure that they have a voice of reason from a healthcare perspective when it comes to their healthcare or their loved ones' healthcare when they're not, when they don't understand what's going on. So many times doctors and providers overlook the symptoms in young adults. Advocate for yourself. If you feel that something is wrong, something is going on, push and keep advocating. If that provider won't listen to you, go to someone else. So I want to make sure that you all are sharing this information because I feel like it's important for everyone to know. Make sure you're following the guidelines. Look it up. Google colon cancer awareness and the Colon Cancer Awareness Alliance for more resources. One thing I want to ask you is, what's one change you will make for a healthier gut? We can get into a whole discussion, and that's another time and another place for things that we can do to make sure that we have a healthy gut. Probiotics, prebiotics, fiber, things of that nature. I want to make sure that you tag your family and your friends on this video. Share it with them so that they are aware. Colon cancer is rising in the young adults, and we need to make sure that we are taking care of them and that they're taking care of themselves. Make sure that you know what the risk factors are and the warning signs, and that you're taking care of your bodies and you're paying attention to your bodies. Your health matters. I want you to listen to your body, speak up, and take action, making sure that you're getting the care that you need in a timely manner and that there's no delay. If you're not sure that if you're dealing with something, is what I wanted to say, and you don't have a primary care provider, we are accepting new patients and we are accepting insurance. So reach out to us. Even if you don't have insurance, we do offer cash pay. So reach out to us if you just have a question that you need to ask. We would love to connect with you and partner with you on your health. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, stay safe and be well. Bye.